I'm Dr. Marielena Alvarez, and today I will present a brief educational video on what finding a lump on your pet could potentially mean. If when petting your dog or cat you find an area that's deformed, usually because it is raised and it is different than the area around it, you should not ignore it. Regardless of it being big or small, painful or not, you should have it checked out. Your veterinarian will make a recommendation based on the mass's appearance, how long the mass has been present, and the rest of the clinical signs that the patient is exhibiting. It is important to proceed properly to definitively diagnose what a lump is. A lump can be something insignificant that many times can disappear on its own, but it can also be something as serious as cancer, which can be fatal. Okay, so let me explain what a lump could possibly be. A lump can be a hernia. That's when there's a defect in the abdominal wall, in the muscular wall, that allows content that's being held back by the muscle to protrude through that opening and be held only by the skin. A hernia can either be congenital, meaning the patient was born with it, or it can be acquired, and they should be repaired with surgery to prevent further complications. A lump can be a bruise secondary to trauma. In this case, the deformity is semi-firm and likely painful or at least sensitive to the touch. A bruise should change daily until it completely disappears. If a lump appears to be fluid-filled, the most likely possibilities is that it is a cyst or an abscess. Cystic lesions rarely pose any danger to your pet. The vet can drain it, but many times it will refill, unless the cystic wall is removed, and that can be done if the patient is put under for any other routine anesthetic procedure. An abscess is more serious. What an abscess is a cavity filled with pus. Pus is a thick, foul-smelling, yellowish to brown fluid with a heavy bacterial load. Abscesses are common in cats, usually secondary to fighting. If a cat is scratched, or more commonly bitten by another feline, bacteria are inoculated deep in the tissues and an abscess will form. A patient with an abscess tends to be systemically ill. They don't have an appetite, they have a fever, and they're depressed. The treatment includes draining the pus out of there. Sometimes the abscess will actually rupture on its own, but if it doesn't, the veterinarian has to lance it to get the pus out. And then the patient is going to be put on antibiotics and non-steroidal anti-inflammatory drugs for the fever and for the pain. Another possibility for a lump is that it can be a tumor. A tumor develops when a group of cells start multiplying and the area they form a part of grows in size. A tumor can be either benign or malignant. Of course, it's a better scenario to have a benign tumor. However, benign tumors are not necessarily innocuous. It all depends on how big they get and what organ they're forming a part of. For example, fatty tumors are common in dogs. They're called lipomas. Many times they can get very big and cause discomfort to the patient, and if that's the case, you're going to want to remove it with surgery. If we have an old or weakened patient, or any patient whose health is compromised that has a benign tumor, it's probably best to leave that tumor alone. However, when making a decision to leave a tumor on a patient, we should confirm that the tumor is benign. And this can be done by aspirating material from the tumor. That sample is sent to a pathologist who will analyze the cells and make a determination as to what type of mass the lump is. The other possibility for a tumor is for it to be malignant, meaning it is cancer. Unfortunately, cancer is a little too common in dogs and cats. Every attempt should be made to remove a malignant mass from a patient as soon as possible. The removed mass is then sent to a pathologist who will analyze the cells and issue us a report stating what the diagnosis on the mass is and if the mass was completely removed. That report will dictate the next step to take, which depending on the type of cancer and if it was completely removed or not, could be to simply monitor the area and make sure the mass doesn't grow again, or the surgery might have to be repeated, being more aggressive and getting wider margins, or sometimes the pet will be referred to an oncologist to receive chemo or radiation therapy. Okay, that's all on what finding a lump on your pet could possibly mean. If you have any questions, please call us at Country Walk Animal Hospital. Thank you and have a great day.